Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Thank you for joining me again on Aging in Place, Strategies and Answers. And I cannot tell you how excited I am for you listeners to benefit from my guest today. So I'm going to dive right in and I'm going to introduce you to Jill Cigliana. She is now the Executive Director of Memory Care Home Solutions. But Memory Care Home Solutions was actually founded in 2002, and it serves the greater St. Louis community. Lisa Barron was the founder and former Executive Director, and she discovered a gap in care partner preparedness when personally navigating the care partner role. So listener, if you find yourself in that stage today, then you know that you are in good company with Jill and myself. Lisa's family was struggling with the daily challenges to support her mother-in-law who had Alzheimer's disease. Lisa observed that there was a lack of individualized services to help families navigate the journey of caring for a loved one at home. And in response, she founded Memory Care Home Solutions with expert guidance from researchers and physicians at the Washington University Alzheimer's Disease Research Center, which is also located in St. Louis, Missouri. Now, the mission for Memory Care Home Solution is to improve dignity and quality of life for people living with dementia and their families by transforming evidence-based interventions into accessible healthcare solutions. So Lisa retired. Well, not really. I hear she's busy doing plenty of other things, which I validate. But Jill, who has been with Memory Care Home Solutions since 2012, then took over the reins of this wonderful organization. So Jill, say hello to my listeners.
Hello, listeners. And Linda, thank you so much for inviting me on today. I'm very excited to share the work of Memory Care Home Solutions.
Well, I am thrilled that you said, Linda, I have a spot on my calendar for you because
Always.
I know Jill is very busy running this organization. So Jill came on board. You told me, Jill, that you came on board with Memory Care Home Solutions in 2012, and I knew that you were a therapist, and I thought an occupational therapist, and then it makes perfect sense to me why an occupational therapist would be such a valued member of the Memory Care Home Solutions team. So can you share a little bit about your educational experience, your role at Memory Care Home Solutions before you became the executive director?
Happy to. I don't think this is a story I've shared with you previously. So I am an occupational therapist by background and trained at Washington University. And for the first 12 years of my career, I worked in hospital and home health settings, so very traditional healthcare settings, and saw that the approaches in those settings were not meeting the needs of people affected by dementia and also not meeting the needs of their family caregivers. So our healthcare system is very good at treating acute issues. If somebody falls and breaks a hip, we know how to repair the hip. Healthcare does a wonderful job of treating infections like pneumonia or urinary tract infections, or providing fluids to somebody who may be dehydrated. But healthcare doesn't always recognize that the underlying cause of many of these problems might be dementia. So we fix the acute health issues and then we send patients home to repeat all of the same problems over again because we haven't given them or their families any help to understand or manage dementia symptoms. So this is going even back before I came to Memory Care Home Solutions, but I worked for a large health system here in St. Louis, and I would refer my patients to Memory Care Home Solutions after an episode of rehab because I knew this organization would help them with the ongoing challenges that we did not address in their rehab stay.
And really, in fairness, could not address because it wasn't billable.
Right. No, there are a lot of challenges and there's so many things to do in such little time in healthcare. So I really started out as an admirer of this organization and a referral source because I saw that this approach filled a tremendous need in healthcare. So after years of referring my own patients, I wrote a letter to our founder, Lisa Barron, one day and asked her, I just felt called to join the team. And so I asked her if she would consider having an occupational therapist on staff. And I was very lucky that Lisa had been advised through the years to bring an occupational therapy perspective to the team. So I have served, I think, almost all of the roles that we offer here at Memory Care Home Solutions I have worked in. I was the director of programs for 10 years, so overseeing all of our patient and family facing services before I succeeded Lisa as the executive director at her retirement 1 year ago.
Wonderful. Were you instrumental in putting together the kitchen? And listeners, just so you know, I do have a video of that, so you can pop on over to my YouTube channel and see that when I post it. But you're going to see what Memory Care Home Solutions has set up. Were you instrumental in setting all of that up?
Yes. I mean, it was really like for an occupational therapist, this was a dream job because we got to build so much around environmental modification and to set up a whole dementia-friendly home right here in our office so that we can work with families on really teaching them by doing together. And it's a really amazing opportunity.
Well, good. And I know that my listeners are trying to create a mental picture, but I already have that for you. So let's just focus on the truth of the situation. And I validate what you're saying is that we do treat what we see, but the things that don't come into the doctor's office, and I talked about that, is that our doctors, our medical system, they're not detectives. So they cannot visualize what's going on at home. If you're not having an honest conversation about, I have seen what is going on in my home. I want to report this to you as a physician. How can you help me with that? The doctor is really shooting blind here and can then only offer help on the other side. So, but that's okay. We're going to walk you through this and you're going to feel better after we finish our time together. Well, listeners, I hope you've taken the time to listen to my 2-part series on dementia. There is testing available and it is covered by your medical insurance. The testing that the physician will do, it will help them evaluate whether the cognitive decline your loved one is experiencing is related to a medical condition or dementia. And in that series, I discuss the kind of testing available and the benefit of having a dementia diagnosis. And as with any disease or condition, early interventions are very helpful. So, Jill, please explain what your unique organization offers people diagnosed with dementia and their care partners.
Well, I wanted to start by saying that I'm grateful that you focused in your series on early detection and diagnosis because we're living in exciting times where more treatment options are available and some of the new drug therapies are only available to people in the earliest stages. So we've never had more incentive to seek a diagnosis early, because if you wait, you may be too late to take advantage of some of the emerging therapies that are becoming available. But here at Memory Care Home Solutions, we offer 4 core service lines, in addition to doing a lot of work around state and federal advocacy to make programs like ours more accessible to people. So home and community-based dementia treatments. Because it's our vision at Memory Care Home Solutions that all people living with dementia and their care partners will have access to an exceptional standard of care to live with dignity on their own terms. And that's different for every person and every family.
And I want to just stop there and say, woohoo. Because when did somebody ever say, I want to go live in a community?
Right.
Nobody ever says that. They want to live at home. And so validating that and understanding that and being a core principle is a big deal, along with the fact that I'm just going to say that there are not enough places built at this time. And in truth and reality, we have to figure it out at home. This is where people want to be. It's challenging, and that's why you need extra support. So thank you.
We need all of the solutions. And we tell people every day here that there is not one right answer. There is not one right pathway to do this dementia journey. So we're fortunate to be living in a time where there's a wide range of options. And that's part of our job, is to help people understand the many options. And that's something you're also doing in service to the community through your podcast, is saying, hey, there's this whole world of options out here.
Absolutely.
We don't understand them all, but let's work together to find the right fit for everybody.
Mm-hmm. Thanks. Yep. I just wanted to validate what she was saying, and for you to pick that up. It's just not words on a page, just not words that we say every day. We really try to make it possible for people to be at home with their care partner successfully and living their best life. Let's take a moment and hear from today's show sponsor.
Which would you rather spend per month, $4,000 to $6,000 and live in an assisted living community, or less than $60 a month and remain at home? The electronic caregiver is a safety device that can help you remain safe in your home in both medical and safety situations. Electronic caregiver can have many options that can be tailored to the needs of the individual, giving you peace of mind. Electronic caregiver is available nationwide. Let's talk. Cheryl Wilson, 314-283-0943.
Let's return to the podcast.
Yes. So we achieve that through 4 service lines. And our first service is the foundation of all of our work. And it's what we call dementia navigation. We've been providing dementia navigation for more than 22 years, which is essentially helping families figure out how to manage dementia progression at home. So in this service, we pair families with a designated dementia navigator who does a comprehensive assessment of their needs and helps them develop a plan for the future. Because families really do not know where to start. They come to us overwhelmed. They're afraid of hurting the feelings of their loved one who's living with dementia, and they're often extremely stressed. So we meet with them, and we can meet in a way that feels comfortable to each family. So some families want to meet with us caregivers only without the person living with dementia. Sometimes they want to include the person living with dementia. Sometimes we meet in person here in our great training venue. Sometimes we meet over Zoom. So it's very flexible. But we meet monthly with them and encourage them to invite as many family members and friends as they would like to these meetings. Because we have found it's very beneficial for many members of the family to hear the same information and get on the same page about a plan for the future. Because nobody starts out on the same page, and that's a real point of contention for a lot of families. And through navigation, we cover everything from the dementia basics, like what are typical symptoms, to specific care strategies for challenges in the daily routine. We can also connect people to primary or specialty care physicians if they need help seeking a diagnosis. So people don't need a diagnosis to come to us, but we will help. If they're seeking that, we will help them connect with somebody who can provide a good workup for them.
And I love that, because we hear on our side, sometimes at Continuum, that it's hard to get an appointment.
Right.
And it might be so far out and you're just not wanting to wait. And so then people don't pursue that. So
Right.
did you hear what Jill said? They will help
Yep.
in that area so that you can get a diagnosis.
And I should clarify, I'm saying the word family quite a bit, but I mean family loosely. So some people don't have bonds with relatives, and
Right.
we encourage them to bring their chosen family. And that can
Yes.
include friends, neighbors, we've had church members. But the important thing is that we work hard to build a village around the person living with dementia, because this is not a journey that should be traveled alone. It's not a one person or even a two person job. So I think we're very fortunate to have the luxury of time to round up these extra people, because it does take a village, and we only succeed by helping the entire village, not just one or two people.
Well, and everybody's struggling to deal with their particular take on this disease. So while the adult spouse might be looking at their spouse saying, I'm losing my spouse, right? One step at a time, but a daughter might be saying, I'm losing my father.
Yes.
Or a grandchild might be saying, I'm losing my grandfather, or a neighbor or a friend is losing a connection.
Yeah.
And so like alcoholism, which affects more than just the person who is dealing with it, dementia is the same way. And early diagnosis, as Jill said, really allows for planning and resources.
Absolutely. And something that we pride ourselves on here is being very strengths-based, and everything we do is through the lens of looking at not all the deficits that are slipping away, but the strengths that remain for the person living with dementia, and for the strengths that every member of that caregiving team or village brings to the table. And families sometimes get caught up on, so-and-so's not doing this, or the bossy big sister from out of town wants someone to do this, but we all have something to contribute. And if you're unified around your love of this person, then everybody's strength has a place to manifest in the support of somebody living with dementia. And everything we do is evidence-based. So the program that we use for our navigation program is called Care Ecosystem, and it was developed at the University of California, San Francisco. And I should add that our program is available at no cost to families, because we have really incredible grant and philanthropic support for this program. But this program is also, in the future, will be covered under Medicare benefits, because this is the program that aligns with this new model of care that you have alluded to on your program. It's called the GUIDE model. It's a Medicare test program for the next 8 years.
Which is super huge.
Yeah.
I am super excited about that. And before we started today, I did ask Jill, what if you're living somewhere where there isn't a memory care home solutions? You're unique in your space. So we thank you for that. But Jill did mention that just call.
Yeah, we don't turn anybody away. We will help and can help in a telehealth capacity to people living outside our region.
Absolutely.
Our second service is in-home occupational therapy, and this is really for our navigation families who want more hands-on training for dementia care strategies. So we send our occupational therapists out into people's homes, where they conduct a real thorough assessment of the cognitive abilities of the person living with dementia, the home environment, and the caregiver's abilities to come up with some hands-on training to make life easier. So we do things like recommend minor home modifications and assistive technology to support both the person living with dementia and the family. And then we work on finding easier and safer ways to manage the daily activities, with a real focus on strategies to prevent or de-escalate difficult behavioral symptoms. So we tell all of our families that the short-term memory deficits is the least of anybody's concerns in dementia. Mm-hmm. The behavioral symptoms are so much more distressing for everyone involved. And this is what people aren't expecting. Everyone knows dementia is a memory problem, but not everyone knows to expect some major behavioral symptoms, and these are super common. They include things like agitation, paranoia, which can look like the person accusing their wonderful, selfless family members of stealing things or misplacing things. It's very hurtful.
Yes.
Wandering, and even resistance to care. So our OTs help the family practice and implement strategies to prevent or overcome these challenges. And occupational therapy is covered by Medicare and most insurance plans. So this is something that people have access to as a healthcare benefit. And the folks, it requires a real commitment on the part of the caregiver, because this is a everybody involved kind of occupational therapy service, but it provides great benefit.
Yes. And if you have a loved one with dementia, you know exactly what Jill is talking about. It's so unique for every person. So please, if your loved one has a diagnosis, don't think that you can lump them into a basket of all people with dementia. It's going to present different. It's going to look different, but it's more about you changing and your environment changing than it is about the person whose mind is changing.
Yes.
And so while we would love them to be able to change so we don't have to so much, unfortunately, I will burst the bubble and I'll just say it's going to be more about you changing and then taking what this team is telling you and putting it into place. So how often do we go and get advice and then we turn and we walk out the door and we don't even listen to it, or we forgot all about it? So,
you have to embrace failure in this work, because you are not going to succeed at your approach every day. And so you're right. Like this work is hard, and the onus is all on the caregiver.
Yes.
Like we cannot change the person living with dementia. We can only change ourselves. And that's a hard pill to swallow.
Yeah, I don't want to change. I was the other person to change. But my daughters have young children, and I looked at them the other day and I said, well, they used to love that. And they go, they don't like it anymore. Now we're trying to find the new normal. And sometimes that's the way it is with dementia too.
Yes.
And you just got to be able to roll with it. And that's not in everybody's wheelhouse to do that.
No.
So this is where this organization and their monthly check-ins can be very, very beneficial.
Well, and it brings me to the third service line, which is individual counseling. Because as you said, this work requires such emotional and mental flexibility to be a caregiver and to meet each day's new challenges where they find you. So that is why we started providing individualized counseling. It's where our licensed clinical social workers meet one-on-one with family caregivers to help support their mental health. This work is stressful. And I think one of the most painful things is that often the person with dementia cannot, by virtue of the disease, recognize their own deficits. So they really, in their minds, believe nothing is changing.
Right.
And so they think they're the same independent people they've always been, which means they cannot thank or appreciate the people who are helping them. And in fact, they lash out and often feel insulted, because any of us would feel insulted if somebody was trying to help us with something that we were really sure we did not need any help with.
Absolutely.
So it's kind of like adding insult to injury. And it's a thankless job. People do it out of, motivation, obligation, the goodness of their hearts, but it presents a lot of emotional stress. And our counseling services help caregivers focus on their own self-care first, so they can continue to be the oxygen mask for the person living with dementia. And the final thing that we do in the community is professional and community education. So we feel really fortunate to get to do this work full time and to be doing it for 22 years. So we're very committed to sharing the best practices that we've learned. Like, we've learned all the lessons the hard way. Let us help you not have to endure some of the painful lessons. So we do a lot of education. We lecture and present to groups of healthcare and aging service professionals around the country. And locally, we present to community groups. So at places like churches, YMCAs, community centers. And we also hold an annual full-day workshop conference in April, and are available to respond to speaking requests if people have a need for some education on these topics.
And I love that, of course, because I told Jill this is what led me to start the podcast is the necessity of learning, because you're going to be better off and more equipped when you have that knowledge. But I had the opportunity to attend that conference, and I'm telling you, they had physicians from WashU, they had people who worked in adult day, they had care providers, they had care partners who told their life story and what they were going through with their loved one, some real life cases. We could watch the video. So it was a wonderful conference, and they do a great job here. So now that you know what they do, you'll be more anxious to make a connection with this organization. Well, as I mentioned, and I'm going to put a video out about this, but there's a bedroom and a kitchen area that have been adapted for those who are experiencing cognitive decline. How is adapting the home environment or the living environment so important for the person with dementia? And I mean, Jill's an OT, so she can't wait to dive in on this.
One of my favorite subjects.
Yes.
Home and any environment presents either barriers to getting through your daily activities or supports. So it's our goal to show families a wide range of ideas to make home more supportive, safe, and enjoyable for people living with dementia and their family members. And we really focus here on easy and affordable practical solutions, because most people don't have thousands of dollars to completely outfit their homes with accessible features and smart home technology, but there are things that we can do that are really simple. Dementia-friendly homes don't have to be institutional looking or expensive. It can still be warm and inviting. So we focus here on things, strategies for safety, like door alarms, low-cost monitoring technology, and fall prevention. We also focus on simplifying technology. So even the most basic household technology, the things we take for granted in our everyday lives, like phones, thermostats, microwaves, and TV remotes, eventually these all become very difficult to operate for the person living with dementia. So there are things we can do to safeguard or simplify technology around the home. And we also demonstrate the importance of reducing clutter and adding visual cues to set a person up for success to complete their daily activities as independently as possible. And we really love being trying out innovative assistive technology. So if there's a piece of technology you might be curious about, chances are that we have tested it and trialed it here, and we can let families interact with it or tell them about our experiences with it, because there are some really great gadgets that are making life easier for family caregivers. So thank you for sharing the tour of because we do have a video of our tour of the training venue. And we have lots of other short videos on our YouTube station too that I would love, we should link together, because sometimes when we test equipment or technology, we make a short little video about it, and that's on our YouTube page also.
I love that. Sometimes people think it's going to be hundreds of dollars, and really it's usually something that is very simple that you just didn't think about.
Yes.
And
we have lots of those kinds of solutions.
Yes, but it really makes a difference in the environment. Now, I have been able to see some of your videos of folks that you have done some counseling with. And I know that some people will think, well, I don't get counseling. I'm not that person. You might be that person when your loved one has dementia. Okay? I'm just saying it. I've been a caregiver, and I know that while it was a wonderful role, it was difficult to balance everything on my plate. And it really tested me. And you're not in it for a day. Like you're in it for the long haul. And so survival is to me is key because, you want what is best, what you can do for the person that you're caring for. So from your experience, how is individual counseling that your organization offers? How's that helpful to the care partner?
Oh, it's incredibly helpful. Oftentimes a care partner can't even implement changes until they've taken care of themselves first. So counseling fortifies the caregiver with coping and resilience mechanisms, like practical strategies to build resilience for the long journey. Because as you mentioned, this is not, many complex health conditions have a shorter tenure than dementia. Dementia caregivers are in this game 10 plus years oftentimes. If you aren't focused on...
And I think Jill's talking about from the
from the beginning.
Yes.
I mean, everyone's progression is different.
Correct.
But it's not a short-term condition.
No.
We should think about dementia as a chronic condition that people live with. Your journey as a care partner will not be brief. So if you connect with a mental health support, it helps you reduce your own stress, stay true to your values and priorities, but also to have a safe, non-judgmental space to work through what feel like very messy and complex emotions that you might not want to talk about or share with your family members or friends. You might feel guilt or shame, but you need a safe space to let those out and work through them so that your mental health remains intact for the journey.
So if you would have a conversation with a friend, I anticipate it going with a well-intended friend saying, well, you shouldn't be doing that. Well, gosh, they should be doing this. You're talking to somebody at Memory Care Home Solutions who has experience and training and understands the limitations of the person that you're working with because they've done the assessments, they've done the screenings, they might even have come to your home. And so who's actually, maybe a well-intended friend can listen, but really you need the strength of that mental health professional because again, they can share small ways and techniques that you can use that will help minimize some of your reactions to behaviors or even help mitigate that. Like maybe there wouldn't even be a behavior if you weren't reacting to it.
That's exactly right.
So I remember one lady I talked to and she goes, I actually go in the kitchen and the pantry and scream.
Yes. You have to let it out. Bottling it up doesn't help anyone.
And then she says, and then I come back. And so she goes, so my pantry has become my solution for working that out. But so that's the difference between a well-intended friend or somebody who really doesn't understand the dementia process.
Well, and sometimes your friends push their own beliefs and values on you. But these decisions are so hard and they're so deeply personal that you need a personal advocate to help you feel really good about the care decisions that you're making so that you proceed on this journey with no regrets. And that's what we tell people. There's no perfect solution, whether you're caring in your home, you're bringing supports in your home, or you have to make a transition to a long-term residential care setting. You want to feel really good about those decisions. And when you have somebody focused on guiding you based on your own values and priorities, you're going to feel good about the decisions you make.
Yes, I totally agree with that. Now, we know from our experience in healthcare that navigating healthcare is just really hard. And so I'm so excited about this guide program that will help people have a better dementia care experience. But we're not there yet with that, but it is coming. So hang on. But navigating care, because you made a mention in the beginning that, sometimes there's underlying things. Just for example, how would somebody go and talk to their physician saying, we had a hip fracture, they're really just declining even more, but I see it more of as a mental decline. Or how do you help people get get back with their physicians or with the people that are on the front lines with them, kind of navigating this process.
Yeah, and this is different for every patient and provider, but what we do is stay in close coordination and communication with people's established providers.
Okay.
So sometimes when the request comes from an outside source, like coming from Memory Care Home Solutions, a provider might take that request to do a cognitive screen more seriously. Or if their provider isn't giving them the attention that to this issue that they would like, we can help them find maybe a specialist or somebody else who's really skilled and comfortable and well trained in assessing for cognitive change. So we really we do coordination of care by staying with open lines of communication with already established providers and helping people find additional either benefits. So sometimes the navigation is things like if your private insurance won't pay for it, perhaps you had a history of serving our country and you're a veteran, and we can help you access this test or treatment or therapy through the VA health system. And that's another complicated beast to navigate. But because we have relationships with providers in lots of systems, we can help people proactively communicate and request the things that they need, and also take advantage of benefits or services they might not have even realized they were eligible for. So we really fully explore the benefits and also help communicate with providers because we talked at the beginning that people aren't often recognizing or detecting dementia. So that makes transitions in care very difficult. If people report to the emergency department,
Yes.
The staff there might not have the time to screen for dementia, and they might send the person right back out the door that you just worked really, really, really hard to get in the door for an assessment. So we will help people prepare and know how to communicate and advocate in those care settings for the person with dementia.
That's huge. And I know that when that happens, there's a greater success. And that's what I hear Jill saying over and over again. We're going to focus on the strengths that the person with a dementia diagnosis has. We're going to focus on helping you be successful. We know there's a lot of stuff going on in that picture, but we can't get bogged down in the negative. We have to look for the silver lining and what is possible. And I think for you listening, anytime we're talking about dementia, I want you to realize that there's a lot of life left to live. And there are so many great interventions available, and trainings are being offered to more people, which is good because many people are not educated in dementia. And we have learned so much on this subject. So I think as such a time as this, we're very hopeful that more people will get more information. And this is why this podcast exists. Jill, I know people are going to want to get in touch with Memory Care Home Solutions. So what's your website and what's the number here?
Our website is www.memorycarehs for homesolutions.org. So I'll say it one more time, www.memorycarehs.org. And our number is 314-645-6247.
And then when they call and they go, help, what's usually the first words somebody else say when they call Memory Care Home Solutions?
Well, they find an understanding ear who is going to validate everything that they want to share, get them on our list for services, and also offer them some immediate connection to support. So we also, we do provide rapid assistance, but we also refer people to the Alzheimer's Association 24/7 helpline if it's a really super immediate need. But we also have our clinical staff on call every day, 5 days a week to take calls that can't wait.
Yes, and that's what professionals do. So I have told you that professionals know the questions to ask so that you can just feel comfortable that you just picked up the phone.
Yes.
So if you didn't hear anything else about what I'm talking about today, then I just want you to know that you have a listening ear available to you at Memory Care Home Solutions. Can they donate on the website too?
Absolutely. And
Okay.
we greatly, our work wouldn't be possible without generous contributions from our community.
Wonderful. So if you want to give in memory of some person, or you just want to support the work of this wonderful organization, I am going to throw that out for you to do. Now, Jill and I have talked, and Jill knows that I was caregiver, and I feel that it's very important to strengthen and encourage caregivers. But I also know that caregivers need tips. So what would be your tip today?
So my tip is that it's kind of what I call the serenity prayer of dementia caregiving. And you don't have to be a religious or faithful person to get this one, but to remember what you have control over. You do not have control over the person who is living with dementia. We each can only control our communication and approach with that person. We can control the environment around the person, as in the home environment, and we can control, by adjusting how easy or hard they are, the daily routine and activities. So think about, what can you do differently? How can the environment be modified? Or how can we simplify activities? That's all we have control over. And just know that the communication part is the hardest piece of this. So give yourself grace and know you won't always be a great dementia communicator, but if you practice every day a little bit, you'll get better all the time. You'll find new ways to connect with the person you love, and you'll find new ways to experience goodness and joy that remains despite this very challenging condition.
Absolutely. Thanks so much for being with me today and with the listeners today, and offering such great tools and tips and encouragement, and to know that they're not in this alone. They're not on this journey alone, and that you're part of the village.
Absolutely. 1 in 3 families. We have to normalize this.
Right.
And be there for one another.
Absolutely. So thank you again for listening today, and join me again on Aging in Place Strategies and Answers. Thank you for joining me today. Please remember that this podcast is intended as guidance and not advice. Share this podcast with friends and family who are currently in crisis mode, or with people who would like to start developing their own roadmap for aging in place. Listeners, if you would like a deeper dive into a topic discussed during a podcast, please subscribe to Aging in Place Strategies and Answers, where you will be able to access premium content. Or if you would like to suggest a topic for this podcast, please contact me at linda.agingstrategies@gmail.com. As always, I value the time you spend with me.